Hello, I'm Dr. Graham, the back pain professor. At least once a week, someone asks me, Dr. Graham, what is sciatic pain? So let's take a look at that. Sciatic pain is when the pressure is on one of the 5 spinal nerve roots. And I want to show you which nerve roots we're talking about. These guys right there. These come out of the lower back, and you can see they form together into a trunk that runs all the way down the leg and all the way down to the foot. And you can see on here that pain pattern. That's what sciatic pain is. Now there's a number of causes for that, so let's talk about some of the causes. First one is a disc problem. In fact, 90% of all sciatic nerve cases come from a bad disc. So let's look at a few discs here so it'll make more sense to you. Here is a slip disc. You can see it came out the back and it's pushing on a branch of that sciatic nerve right there. Now what we're going to do is we're going to turn that over and you're going to see inside the disc. See, here it is. There's the jelly in the disc wanting to come back and it's pushing the outer covering of the disc right on one of the branches of the sciatic nerve. This is a disc bulge. This is what a lot of people have. These are detected by an MRI. Here's an MRI. You can see the discs generally are black because they're degenerating inside and the jelly's slipping out. And I want to show you where it's slipping out. Looks good, looks good, looks good, right there. That's where it's slipping out, right there, and it's getting right on that nerve. And the one right below it, there's a bulge there as well. Now let's take a look at a herniation. Now here's a herniation. See the difference? See how it pushes the outer covering out? This time that jelly just came clear out of the disc. That's sitting on the nerve. You can see the MRI. Look at this. Good. There's the bulge. Look at this thing. This is about a 10-millimeter bulge. These oftentimes go to surgery. This person's going to have pain down in their back, down their gluteal, all the way down to the foot. Sometimes they might even lose their reflex or their muscle strength. These are very difficult cases. Now, let's look at another group. This is called stenosis. Generally, stenosis you find in older people that have had some arthritis build up. You can see, here's a good example of it. You can see these bone spurs surrounding the entire spinal bone. Now they're coming back. The bone spurs are now they're getting around that nerve there. That's part of the sciatic nerve distribution. Let's take another look at this model. This is inside the spine. You can see the bones are coming out and squeezing that nerve, and they squeeze it from this side, and there's some more squeezing from the back side. So this thing is really getting pressed on. This person's going to also have pain down their leg. Sometimes they can go down both legs. Now here's the corresponding MRI. You can see how open the white is. Good white, good white. Oh, now kind of the white disappears and it's getting hit from the back and from the discs, and that's what stenosis is. Now let's look at another cause, which is pregnancy can actually cause sciatic pain. You can see the little munchkin here, the little fetus. The head is actually pushing on some of those branches, and that's going to cause that pain to run down that leg. Here it is right here. You can see it's going on down. Another cause of sciatic pain is spinal tumors. And spinal tumors are best picked up on MRIs. And this, by the way, is a very infrequent cause. Now, let's talk about treatment. Now, treatment, I think, is done best with this computerized, state-of-the-art adjusting instrument we use. And this has a computer chip inside, which makes it much more precise. In fact, I could never, ever adjust as well with my hands because the speed of this instrument is much faster than my hands could ever be. And the speed is what helps move these bones off those nerves. The other thing about this instrument is that it's very, very safe. It's actually certified by both the FDA and Underwriters Laboratory. And probably the best thing about it for the patients is it's painless. I'm Dr. Graham, the back pain professor.